We now have the week 48 data for the Momentum study, the big phase 3 trial pitting Momelotinib versus Danazol in patients who have been previously treated with JAK inhibitor, who are symptomatic and have anemia as a result of their myelofibrosis. And the data was positive, and of course we eagerly anticipate the approval here perhaps in the next few days. Clearly, the biggest factor here in how it will be used is the label. What does the FDA label indication look like? Because that often helps guidelines panels as well as third-payer insurance companies to what populations this will be applied to and what will be covered and not covered by insurance. And so I think that's a big piece of what we're looking to see here, in addition to just getting approved in general. You know, the data in Simplify-1 was very intriguing in terms of its comparison against ruxolitinib in the frontline setting. And although the trial wasn't completely positive, I think you can argue that a lot of the challenges that Momelotinib faced in that study were because of trial design, and that could have been improved to show a proper difference between ruxolitinib and Momelotinib in that case. And two, the fact that I think as time has gone along since the approval of ruxolitinib, we've become better at caring for patients with myelofibrosis. And this is supported by some clear evidence in Medicare claims database research. And then, in fact, JAK inhibitors, particularly ruxolitinib as a single agent, outperforms expectations that we get from the COMFORT studies. And so now when we look at trials like Simplify-1 or these upcoming combinatory therapies comparing ruxolitinib plus another agent versus ruxolitinib alone, we have to keep in mind that ruxolitinib will probably outperform our expectations in those control arms. So I think you got to kind of temper results, expectations and the results with that in mind. But certainly, you know, Momelotinib could provide help for patients who are anemic, even in the frontline setting, and certainly I think is going to provide another option. But there are a lot of things we're still waiting to see, particularly the label indication and what that looks like before we can kind of fully say, yep, this is going to jump into the frontline setting.